Hi, I'm Dr. Rossler. I'm one of the biology faculty at Johnson and Wales University and also one of the pre-health advisors. And I wanted to take a little bit of time to talk about the application process and what's required to gain acceptance into various medical and health professional programs, because it is quite extensive and it's good to have a good start right from the beginning. All right, so let's go ahead and get started. All right, so one of the fields that many of you might be interested in is MD, or medical doctor. It's a doctorate program that requires 4 years post-college undergrad, and then there's an extensive residency and internship that's often required depending on your specialty that you go in. Oftentimes you're getting paid during that residency and internship. And then there's significant academic requirements. So we're going to go over those in just a second, but that's something to be very mindful of, especially as you progress through your undergraduate program, that you're hitting all of the courses that are required to gain acceptance. They're quite extensive. You have to take a full year of biology series with labs, a full year of the general chemistry series plus labs, full year of the organic chemistry series plus labs, and a full year of the physics series plus labs, in addition to some other courses. So I'll be showing you how you determine what courses are required for medical school, and so it's something to be keeping your eye on. Just FYI, at Johnson & Wales, the biology major actually completes all requirements quite handily. And yes, we often have a lot of biology majors who are interested in going to med school, but you can be a non-biology major 100% and still take all the courses that are required. You just have to be a little bit more mindful of it as you progress through your education. What we're going to see also is that experience is going to be helpful in the application process. We'll talk a little bit more about that down the road. Maybe something you want to consider in addition to doing all your coursework is to do some work as an EMT, medical scribe, CNA, et cetera. We'll talk about that in a bit. Also, some volunteering is a great idea. Now, one thing that you've probably heard before is that there's a test that's required to gain acceptance to medical school called the MCAT. It's a pretty challenging test. And one of the big challenges of it is that there's actually no calculator allowed. So even though you're doing a lot of physics problems and chemistry problems that often require math, you have to be trained and learn how to do it quite quickly on your own, which is doable. We'll talk a little bit more about that down the road as well. The big thing to keep in mind, especially for beginning this process, is that grades actually matter. Mastery of these courses is important. These spots are quite coveted, and you want to make sure that you are the best candidate possible. So high grades, again, what we mean by mastery, you really need to understand it because that material is going to be on the MCAT, and yeah, you need to understand what you're doing so that you can be a fast learner and learn how to study well, and so that you can digest material actually quite quickly. On average in 2020, the MCAT that was needed for acceptance was in the 80th percentile. This works out to be about a 510. Also high GPAs, we'll talk a little bit about that, and it's usually up in the 3.7 or above range. Now, interestingly, I want to pay attention right now is that the average age upon acceptance for most programs in 2020 was 24 years old. So that's sometimes shocking to students that it's a typical 2-year gap that many students are going to take in between undergraduate and starting medical school. So just file that away. All of this leads to, there's many people who are called, and it's actually quite challenging to get accepted to medical school. Last year, the acceptance rate was 6.7%. That's actually down from previous years where it was a little bit higher in the 7% range. It got harder last year. I think there were more people applying because of the COVID response, and they call it the Fauci effect. So just FYI, there's a lot required, but you can totally do it. You just have to kind of be mindful of it throughout your whole undergraduate. Another interesting field that you may or may not know about that's similar and almost, so what we were talking about before with MD is sometimes referred to as allopathic medicine. There's another type of doctor that's great. It's called osteopathic doctor. It's also a doctorate program, very, very similar to that of what you would do as an MD. There's a little bit of emphasis on family medicine and holistic care. and sometimes more in rural areas, but it's a great path. I have several friends who have done that as well. And what we see is that similar requirements, almost identical requirements to what you saw for the MD path. The only thing that's really different is that there are fewer programs, but the acceptance rate is much higher. So it's about 30% in 2020. And again, we have an average age of acceptance about 24. We see that the MCAT required for gaining acceptance is just a little bit lower. Instead of 80% like we saw before, here it's about 50%. And a really good GPA, still 3.5 is the average. So it's a fantastic field. You can look into the differences and similarities between MD and DO if you're interested, and I highly encourage it. All right. Some of you may be interested in dentistry. We've actually had several students from Johnson & Wales now accepted to various different DMD programs. It's also a doctorate program, similar to what we were talking about before, 4 years after college, residency and internship. And again, significant academic requirements. The biology major, again, encompasses all of them. But again, you can totally be another major and get accepted. Actually, one of our former alums who is now in dental school was a health science major. And so we also have biology majors who have been accepted. So again, one of the big things that's a little bit different for the application process between becoming a dentist versus becoming a medical doctor is that a little bit more experience is recommended. So we'll talk about that. Dental assistant is great. And you can start early. Sometimes you can reach out to various different dentists and they will train you. So that's a great gig. Also, you can consider doing a dental assistant program, sometimes in the summer, etc. There's also a test required, very comprehensive. It's called the DAT. Again, about 80% or higher is the typical for acceptance last year. And again, very strong grades. And again, a pretty common 2-year gap year is the average for most students. And again, the reason why we're going to see these gap years are important is because schools require so much and they require these tests to be quite high in terms of your percentiles that you gain on it. And so it takes a lot of time to kind of study for all these tests and get all the experience that you need. And you need to have taken a lot of courses, right? So that's typically why the average age is a little bit later. And I will encourage you to wait, right? If there's not a race and you want to be the strongest candidate you possibly can before you actually apply, it's much better to apply once and have really a strong application rather than just rushing into it, just seeing what happens. For medical school in particular, there's an emphasis for first-time applicants getting better interview slots. Right. So the first time interview slots, the first time applicants actually get the best interview slots and often get accepted more than returning applicants. And it's similar for dentistry and for other programs, but much more. We see that with the MD programs for some reason. But so it's an expensive process too. So every time you apply, it's quite pricey. So I will just highly encourage, if you're interested in MD, OD, or DO, or dentistry, to consider just slowing down, making sure you're the best candidate you possibly can be when you apply. Many of you I know are interested in physician assistant programs, and it's near and dear to my heart as I sometimes teach for those programs. So it's a master's program. It's very intensive, right? We sometimes liken it to trying to drink water out of a fire hydrant. It's a lot of material coming at you fast and furiously, but it's a great path. It's 2 to 2.5 years for most programs after college. You're not allowed typically to work outside of being a student because it is so intensive. And so what we're going to talk about are a little of the differences. There's a test called the GRE that's very similar to the SAT in some ways. There's a mathematical and quantitative that you'll need to take, as well as a writing assessment in that test. You do not need to take the subject test. And what we're going to see again is that strong GPAs, especially in the science courses like we saw before, are going to be the norm. So the average last year, I think it was in 2020, was a 3.6 for acceptance. And we're going to start talking a little bit about this thing called BCP. Those are specifically your biologies, your chemistries, and your physics courses. So in all of your coursework, you're going to have to take a lot of science classes. And we're going to see that those science classes are really important. They actually tease those grades out, especially for med school and dental school and PA school. They're going to tease the grades out of your sciences, and they're going to calculate it either as your BCP, like we have here for PA, or your BCPM, which is including the maths. So just be aware that those courses count a lot more. One thing to also pay attention to is, unfortunately, non-science courses, they will be calculated into your overall average GPA, which is very important as well, but they are not going to be calculated into your BCP. One of the caveats of that, right, is like public health or health science. Even though they're great courses, and I encourage you to take those sorts of courses, they will be calculated into your overall GPA, but not your BCP or BCPM GPA like we see here for, here in PA. So that's just something to be mindful of. Again, so as soon as you get into those biologies, those chemistries, and those physics courses and math courses, you take them quite seriously. You should take all of your courses seriously and try to master the material so that you're learning quite a bit. But again, those grades are of particular importance. You're going to hear that one of the grades that's often looked at for PA is the anatomy grade or the physiology grades. I think those are quite important, as well as the chemistry grades. Similarly, with the MD path that we were just discussing and the dental path, again, all those chemistry courses are quite important and somewhat reflective of how students will do in medical school. I've heard, I don't know if it's an old wives' tale or whatnot, that the organic chemistry grade in particular for med school is one of the most important, because it kind of is predictive of how you'll do in these really challenging courses in med school. All right, hopefully that's making sense. Let's move on to veterinary medicine. We've actually had a large number of our undergraduates who have been accepted to veterinary schools. We're very proud of that. So again, some biology majors and some equine majors. And what we see here is that it's, again, another 4-year program post-college. Most schools are going to require a GRE, which again is similar to the SAT. Every once in a blue moon, there's going to be a few programs that request a different test, the VCAT or the MCAT. So, and again, what we're going to see here is that the academic requirements vary quite a bit from school to school. And I actually have a link that I'll be showing you in a second about how you determine the schools that you're interested in. Now, vet school course is similar to PA, that they're going to require you to have clinical contact care hours with animals. And a good goal to shoot for is about 1,000 hours. And also a really high GPA. We're also going to see here, again, the same thing we saw before, about a 2-year gap year is kind of the norm, because again, it's just so extensive. You get all these contact care hours. And again, you just want to be the best applicant you possibly can when you apply. Only about 10 to 15% are accepted each year. There are a lot of different vet schools in some way are almost harder to get into because there's not quite as many as there are for like medical programs in the United States. But there are a lot of, international programs that you also might want to consider. We have one student who's in Canada right now in vet school, and we have some students, I think, in the Caribbean too, in addition to, other places in the United States. So something to think about is that there's a wide range of programs, and to not limit yourself maybe just to the United States programs, even though they're fantastic. Many of you might be interested in PT, physical therapy, and I think we have we've actually have 2 students that are former alumni of our program in biology that are actually about to finish up their doctorates in PT. Again, high GPAs, GRE is going to be required, and I'll encourage you to get clinical observation time with a PT. Sometimes that's working as a PT aide. That's going to be super important to make you stand out. We're going to see about 31% acceptance rate, and I think the average age is still around the 24 ballpark. Again, in terms of the coursework that's required, I have a list that's going to show you that. There's a little bit more emphasis on the physics as well as anatomy and physiology, of course. And again, another great path to consider is occupational therapy. I think this is one of the more interesting kind of fields that's kind of blossomed in the last few years. great pay. You should look into the various different pay rates of all these different programs. There are master's and doctorate programs available. I think there's a little bit more of a push now for programs to be doctorates, and I'll encourage you maybe to look at those first and foremost, because I guess there's some debate about in different states about what is going to be required, whether or not doctorates are going to be needed versus masters. And doctorates will often it'll never be a problem if you have your doctorate. Right? We're going to see that the GRE is also required, again, similar to the SAT. Again, very good grades. Again, an emphasis on your anatomy grades is going to be important. A little less requirements. There's not quite as much science that's required, but again, if you have those science classes, it'll just make you stand out. And I will still encourage you to take many of those science courses if you're interested in the OT path. We're going to encourage you to also do some contact care, right? So also working with OTs in various disciplines, so you can learn more about it. I didn't actually know as much about occupational therapy until a few years ago. And again, I find it very interesting. Just if you didn't know what an occupational therapist does, they are specialists that work with patients to regain healthy living. So a PT is going to help patients, of course, regain movement and have less pain in the motions that they make in their lives. An occupational therapist is a little bit different, very similar, but a little bit different from my understanding, in that they're going to help you regain your life. So stroke patients, after they've had a stroke, need to relearn how to brush their teeth. They need to learn how to drive a car in a special way. Right? Kids who are autistic or people who are autistic sometimes need additional help in terms of developing skills that an occupational therapist works with. People who are dyslexic sometimes need extra help learning how to write in a specific way and build up muscle tone so that they can successfully write better. So it's a wide range of things that are just really impressive. And we have, again, an alum who's finishing up her doctorate, or actually we've got two, I think, to my knowledge, that are finishing up their doctorates right now in occupational therapy. Johnson & Wales, of course, has a great program, an OTD program, doctorate. And if you're interested in that, you should Google our JWU OTD program. We have an articulation agreement between the health science and the biology majors. If you are one of those, that you may be able to gain your interview and admissions in a little bit more direct pathway, and not maybe take the GRE. And there's some special scholarships, I think, that are available as well. So it's a great path to consider. And when I've talked to those faculty, they've just been great. And just to remind you as well, I should have mentioned it, that the PA program, of course, with Johnson & Wales also has an articulation agreement. And we'll be talking about that. All right. So people who are in the biology or health science majors may be able to, if upon successful completion of their articulation agreement, get a fast track for an interview, which is huge. And it helps a lot. Many of our students who are actually in our JWU PA program all took part in that. All right. So we'll talk about that in a little bit. I apologize for not mentioning it earlier. All right, well, let's go back to where we were. So again, for occupational therapy, there's a wide range of programs. I will encourage you to look for accredited programs because many have blossomed in the last few years. And I think, it's always better to go with a program that has an accreditation so that your license is, in good shape. All right. What are we going to take away from all of this? Hopefully you've noticed that one thing that you want to be thinking about early on are the prerequisites for these different paths. All right. There's a lot of common ones, but there's some special ones, especially for like vet school. So look at those prerequisites and plan ahead. If you are not a biology or health science major, you may want to consider doing a chemistry minor, especially if you need to take a lot of chemistry courses, especially for like MD or PA. And so that's a great way at Johnson & Wales to be able to get those chemistry prerequisites kind of filled without overwhelming your other free electives. All right, so you might want to talk to your advisor or your SAS advisor, or feel free to talk to me about that. Grades matter, unfortunately. Mastering of these classes is really important. These spots, you can see a lot of people are trying to get them. And the only way that these programs know to determine who has the background needed to be successful is kind of by looking at your grades as well as your experience. So take that very seriously. If your grades are starting to tank, you should talk to your advisor about what to do before the drop dates. That's an important thing. We definitely don't want any D's or F's. And if you get a D or F, it's not impossible to get into these programs. It just starts making your life a little bit more difficult. And again, C's even, we try to just, try to avoid them. That shows that you just haven't mastered the coursework or taken or had some, issues in the course. Again, we're kind of going for more of the A's, obviously, and B's. So again, but it's ultimately, it's a delicate balance between trying to encourage you to worry about grades, but also to be thinking about you need to understand this material. It's not just, for giggles. It's actually because it's going to make you a better clinician. If you're going the MD path, you need to understand that when you're looking at certain drugs and their toxicity, what that actually means. There's a lot of stuff, and especially for the PA path, we need you to know from the get-go a lot of material so that you're successful in that program. All right. Experience, as we've been saying, is very important in many of these paths, and it also is going to make you shine or show that you kind of pop off the page as an applicant. We're also going to see these test scores can be very important, as well as recommendations. So we're going to talk a little bit more about each of these. All right. So as those prerequisites that I mentioned, I have sheets that hopefully you'll be either accessing directly from me, or you will hopefully be able to get on our website that's coming soon. And your advisors also hopefully have access to them, but you can always reach out to me and I'll make sure I give you these links for the prerequisites. You can also look online. So again, many of these programs have websites, and I'll be showing you some of those in a second. Again, as we said, grades are important. I will encourage you to get tutoring, right? Even our best students who get straight A's, they go to tutoring. It is not something that's just for people who are struggling, but it also can help you if you're struggling. We have free tutoring at Johnson & Wales. You guys are very lucky that that's the case, and so take advantage of it. Also, office hours with your faculty, take advantage of it, right? We are available. We like students, and so I will encourage you to take advantage of the help that we might want to offer. And if you get off track, it happens, right? People get sick, there's family emergencies and deaths, etc. It happens. Everybody does get it. Just because you get off track doesn't mean that you can't still get accepted into these programs, but we want to be really kind of focused on getting you back on track, right? Consider retaking a course if things don't go super well. Right, especially if they're on the lower end of the continuum, because you do need to master, especially your science courses, those BCPs and BCPMs. So anyway, so just take that for what it's worth. I don't want to instill a lot of anxiety in you, but at the same time, a healthy sense of motivation is needed. Right. All right. So one thing I wanted to pay particular attention to with grades is that if you've been at Johnson & Wales, one thing that you may not realize is that our grades are a little bit higher in terms of how we allot points for GPA than other institutions, and how they will be calculated when you apply to these professional programs. Kind of a cool fun fact. So at Johnson & Wales, if you get a B+ in a course, just so you know, a B+ at Johnson & Wales is an 85 to just shy of a 90, right? So an 85% to just shy of 90. And if you get an 85 to just shy of 90, you will get 3.5 points per that, for that class from Johnson & Wales. Now, just so you know, when you apply to these professional programs, you're going to have to put your grades in, and they're going to look at your transcript. So obviously, you can't lie about this sort of stuff. It's a come to kind of Jesus moment. Right? But when you put your grades into all of these professional programs application processes, we're going to see that B+ is going to drop just a smidge down to a 3.33. And the same thing for a C+, right? We can see that a C+ at JWU is going to give you a 2.5 GPA, whereas when you adjust it to the national average or to these, these bodies who do the applications, we're going to see it's going to become a 2.33. Again, A B plus is a great grade. You should be really proud of yourself, but just know you're going to take a little bit of a hit in terms of the GPA. All right. So this is why we kind of tell students to hustle. And again, we can see that there's a big difference between a C plus and a B, right? A B at Johnson & Wales, you guys are very lucky, is an 80 to just shy of an 85. And that will be a 3.0. But we can see that if you drop to a C plus, when you adjust for your GPA, it's going to drop down to a 2.33. So I just tell you this to be aware that when you apply, your Johnson & Wales GPA does not directly correlate into what your GPA is going to be when you apply for these programs. All right. And I have I'll show you an Excel sheet that I have that's going to help you calculate that so that you have an understanding throughout your program here at Johnson & Wales, how to calculate your GPA. Also, I just want to remind you some other little intricacies with Johnson & Wales versus when you apply to these programs is that your Johnson & Wales GPA tends to, like if you retake a course, we have students who retake courses periodically. It's a great idea to do. I will encourage you to do it if you have struggles with material or a course. But if, say, they got a C on it the first time and they retake it and get an A, at Johnson & Wales on your transcript, the C that you got previously is going to go bye-bye. It gets expunged, and the A replaces it. All right, so that's fantastic for your Johnson & Wales GPA. However, when you apply to these professional programs, they're going to see it all. All right, so the C is going to show up as well as the A. It's still great because you're showing them that you were taking this class, you really wanted to learn the material and you put the time and the effort to retake it and get a higher grade, which is great. However, just know in the kind of the grade madness that it kind of gets averaged out. So when you're adjusting for your GPA, your grades in these sort of standardized systems through CASPA, through AMCAS, et cetera, they are going to standardize it because there is variation amongst universities, right? We see that, right here at Johnson & Wales. So just so you know, you are blessed at Johnson & Wales that we do not do minuses. Please understand that if you take classes at other institutions, they're typically going to have an A minus or a B minus or a C minus, et cetera. And those are kind of GPA killers as well. So if you're at another institution or you take it during summer school, et cetera, you're going to see that, oftentimes an A minus gives you a 3.67. A B minus gives you a 2 points. I say B minus is going to give you, what did I say? An A minus gives you a 3.67. I should write this down. And a B minus is going to give you a 2.67. Yeah, it's quite a GPA killer. And a C minus obviously is even lower. So just know that we don't do that. We don't do minuses, and you're actually really, really lucky that we don't. Okay, so your B is going to be a B no matter what. Your A is going to be an A no matter what. And just know that if you go to other programs, A minuses though you can take a hit in your GPA, and B minuses you can take a hit as well. All right. So these tests we've alluded to. Many programs, of course, we're talking about the GRE. Let me write on here. Actually, I've been needing to do this. So when you think about the GRE, I will encourage you to study for at least 3 months for it. Oftentimes, students will just buy a book, right? Another great thing that I recommend, this is just from personal experience, is there's an online program called Magoosh that has a really good online GRE program that many of our students have taken and really improved quite dramatically. Sometimes it goes on sale, so just be on the lookout. It's not super expensive. I want to say it's like in the $100 to $200 kind of category. So play around with that and feel free to ask questions from your advisors on how they studied for the GRE. So all of us who went to graduate school all had to take it. And so that you do not need to take the subject test unless you're actually going to a program in that field. For instance, I had to take the subject test for biology, right? Biochemistry, but you will not. So since you're going to a professional program. Again, what we're going to shoot for in terms of percentiles. So there's these percentiles that the numbers are based upon. And I will encourage you to go for a greater than the 50th percentile. That's a really good goal. It doesn't mean that you won't get in if you have slightly less than that 50th percentile for these programs, but that's a good goal, is the 50th percentile, okay? I think that tends to be about 150-ish on both sections, on the quantitative and the verbal. But again, there's some variations. Each year it's graded on a bell curve. The MCAT and the DAT, I will encourage you to plan on studying on, I'm not joking, for at least 6 months for that test. I will encourage you to look for online study programs. There are many different ones. There's one that I've liked a lot. It's called Leah for Science. She's actually, I think they're free actually online in YouTube. She does a great job of doing tutorials specifically aimed for the MCAT for, so specific tutorials on the MCAT for the chemistries and organic chemistries and biochemistry. And I think she's great. I actually sometimes sign them as homework in my courses. So she's a great free one. But I'll also encourage you to consider, in addition to buying the books that you can buy at the bookstore for the MCAT or the DAT, something you may want to consider saving up for now, if you're early on in this experience, is taking a Kaplan review course or a Princeton review course. So these are two companies that kind of have great, patented MCAT or DAT study programs. They also do GRE, FYI, if you're interested in that. But these are, pretty good, really good programs, and it's a pretty intense study program that they have in place, and they will give you unlimited free tests that you can take. And again, when you're thinking about taking the MCAT and the DAT and the GRE, I'll just encourage you to do a lot of practice, right? So in addition to studying, you take a lot of practice tests, because the timing is kind of challenging to get under your belt so that you can go through confidently and get through the material in a quick pace. If any of you have academic accommodations, especially if you have learning differences, I will encourage you 100% to use your accommodations for your test. So what this means is that when you're signing up to take your course, signing up to take the GRE, the MCAT, or the DAT, etc., you will submit your accommodations. So usually your accommodations have, there's a very specific way that, specific criteria that's required for a student to get accommodations. So if you have them, a little bit about that, use that. Again, many of our best students who are now successfully in programs have actually used those accommodations for these tests, and it just gives them a little extra time. Sometimes it'll allow them to take the test instead of on a computer, on a piece of paper, and sometimes they just get extra breaks, okay? So that's some fun facts. All of these exams are kind of expensive to take. So again, you don't want to take them over and over and over again. They actually don't even allow you to take them super repetitively, right? I think there tends to be limits on the number of times that you can take them, and you can look those up for your various different tests, but you want to take it seriously. And and just be prepared. All right. Oh, let me get this. Annotation clear. All right. Some other things that you're going to hear about is this term shadowing. So I think pretty much everything we talked about, a good thing to do is to get some shadowing experience. What shadowing is that it's an early introduction to the field. What you can do is follow around a person who is of that job, right? So if you want to go to med school, you would follow around some doctors. You could also follow around some PAs. It's good to learn about the different types of clinicians that are out there. But of course, you would want to make sure that you followed at least two persons who are in the field that you want to go to, but two different people, obviously. So especially for PA, you need to make sure that you've shadowed at least two PAs in different fields before you actually apply. It can be hard to get shadowing experience, especially in the age of COVID. Another thing that's been working in the age of COVID is to talk even in a Zoom conversation with somebody who is in this field. They may not be able to have you come to their office and shadow them for the day and watch them as they do their job because of COVID restrictions, but they may be more than happy to talk to you via Zoom about what their experiences are like being in that role. And while you're not going to get as many hours that way, it's something that you can do pretty readily. I know in the pre-health club, to which I'm an advisor, And you can email me if you need to learn how about joining the pre-health club. That's one thing that we're working on a lot, is getting people in the field to come and Zoom in or come and talk to us, in the pre-health setting, and so that you can ask questions and they can talk about their experiences. And so that counts actually as shadowing. It's pretty great. Anyhow, you're going to try to get at least 20 hours, I think, for all the fields that we've talked about. I think that's a good goal. And again, sometimes it's going to be easier, sometimes it's going to be harder. There is a little bit of flexibility now to have less or more, obviously, and in the age of COVID. So what shadowing is, as I said, it's just you follow the person around oftentimes, or just ask them questions about their experiences. And and this is something that you can do even as a first-year student. So during those breaks in between Christmas or spring break, et cetera, maybe reach out to pediatricians, family friends who are in these fields, and just ask them if you can shadow them or talk to them about their experiences. And you want to keep kind of like a log of how many hours you do. So that someday down the road that you can put this into your application, because they're going to ask you about who did you actually shadow with and what was their name and what did they do. And again, we don't want to lie about these sorts of things and make them up because there's the possibility that they do spot check. So anyway, let's see what else. Yeah, and of course, be professional when you shadow. I think it goes without saying. Take it seriously. This person's going way out of their way to help you in your career. And we want, of course, Johnson & Wales to have a good reputation. So just always, of course, put your best foot forward. Ask questions. They love it when people are curious. If they have time to answer your questions. And what else? Yeah, another good thing is to send them a thank you card afterwards, okay? Or at least an email expressing some thanks, because they are really going out of their way to help you. Sometimes it can lead to a job too. So take it, good luck with that. All right. Some other things that I encourage you to think about as you're going through your college career is joining clubs and being part of organizations, Greek life, different clubs that are on campus or off campus, sports, etc. All of those things are going to show that you are interacting with the community, right? You have more experience, with other people, right? And it just shows that you're kind of a go-getter. And if you can take a leadership role, be a captain of your team, or if you can organize certain things in your clubs, that's even better. All right. So try to, take advantage of that. The more of that sort of stuff you have, the better. And then another thing that I'll encourage you to think about is research or lab opportunities. There's a lot of different, if you're at Johnson & Wales and you're a biology major, we often send out sort of like want ads for students to do research projects with us. Health science, I know, does a lot of those, psychology as well. So whatever major you're in, if you see those sort of opportunities pop up, take them, right? Sometimes it's hard to get in, but just keep trying. I encourage you to, try early, and and hopefully you'll get one of those. Also, I'll be emailing you all about various different research opportunities that come up during the summertime. There's actually a large number of programs at big universities for students to gain research experience and some, pre-med experience in particular, because, it is hard, right? So some, big research universities have more labs, and we are actually able to compete with them because we do research as well. But then there's also these summer programs that are, they want help. They want to help you in your research career, and they actually, they like that you're working for them. And so I'll help you try to think about how you can apply for those various programs. We've had many of those students actually get into those programs. So you sometimes have to apply to 10 to get into one, but it can be done. And again, keep maintaining a log of what you're doing. All right. And also, if you wanted to, you could look at AAMC. It's a website, the American Academy, I think, of Medical Colleges, and they have a specific link there for research opportunities. Another really important thing to think about for all of these is to volunteer, right? This is, again, something that just shows you're part of the community, you're a go-getter, but also that, that you're learning how to interact with people who sometimes might need help. So some great examples of this are becoming crisis counselors online. So if you Google, online veteran suicide hotline counselor. There are organizations that will train you to be to work a hotline as to talk to somebody who's actually considering suicide. Right? They'll call in sometimes, and they'll train you how to communicate with them. So developing your skills of empathy, et cetera. They have similar ones for elderly. This was really important during the COVID crisis, and they're still continuing. I think that, interestingly, a lot of people feel more comfortable talking to someone that they don't know than to somebody that they actually know about some of these concerns that they might have, or depression or suicide. So I will encourage you, if you're of that mindset that sounds interesting to you, to do so. I have several students who've been doing it. One was telling me about that she gets the 12 a.m. to 4 a.m. Slot, and it doesn't mean she has to always be constantly awake from 12 a.m. to 4 a.m., but she just takes her phone into bed with her, and when it rings, she just pops up and, of course, talks to the person on the other end. So it's a great way to get some experience even in the COVID age. Tutoring, you can also, if you're kind of good at any specific skill like biology or chemistry or physics, et cetera, they're often needed in elementary schools and high schools. Reading, there's reading tutors. So that's all great experience. And again, developing your Zoom kind of skills, and you can, get some good time in that way. There's also hospital volunteer programs. I highlighted Miriam Hospital because we've been having very good luck actually getting our students into Miriam Hospital as a volunteer. All you would need to do is just Google Miriam Hospital volunteer, or any of these other hospitals, and you can hopefully find they have volunteer programs. I will encourage you to not sign up for these volunteer programs, any of them, unless you actually have the time. Students sometimes get overextended, and we would much rather you, I don't want you to do it unless you actually have the time to commit to it. And so we want to make sure that, you're keeping your grades up. That's, again, probably, it's even more important than volunteering at this time. You do have, summers off. You do have, holiday vacations, et cetera. Those are the times maybe to do some more of that sort of stuff. So again, right before summer, I'd say like in April, if you're not volunteering during the school year, something to think about is that around April, starting to look at these hospitals and getting into their volunteer programs. Your hometown, if you're not, of course, in the area, something to look for is the hospitals near you. In April, I will encourage you to kind of, just Google whether or not they have volunteer opportunities that are arising. All right. They go fast, just FYI, right? Because there's a ton of pre-med, pre-PA students out there who are trying to get these volunteer hours at hospitals and clinics. So there's a bunch of them. There's Rhode Island Free Clinic is one example. Nursing homes will always take you no matter what. So even if you can't get into a hospital, I would encourage you to volunteer at a nursing home. All right, and keep track of all those hours. All right, some other fun, interesting things that you may want to consider are these medical travel abroad programs. There's many different types for dentistry, physical therapy, even occupational therapy, med school, et cetera. We have students, I have a student right now who's in Peru working at various hospitals there, and also living with a family and getting her Spanish improved. We've had students go to Vietnam, Costa Rica, Mexico. I had a student who, I think for spring break, went to Costa Rica and helped fit eyeglasses for people in those communities. So those are all really interesting. You get a lot of volunteer hours very quickly, especially if you're there for a week, et cetera. And they can be costly. I'm just going to put that out there. These are companies who organize these trips to sometimes make money, to make to increase their revenue. So as wonderful as they are, have just have that thought in your head that this is not free. There's the possibility that some religious groups have what do you call it, where they go, where they do good works in other countries, and sometimes that's of a medical nature, and so sometimes you might be able to do ministry, I think that's what it's called. Yeah. So, look around, they exist, right? And there are some students who've done some very interesting things. One of my students who went to Costa Rica, she said, they would work all morning, till lunchtime or a little after lunchtime, and then they would go to the beach. So as much as it was wonderful that they were doing all this work with the community, they also did have a little bit of time to do some tourism-y stuff. So take it for what it is. All right, more experience stuff. And I think we're almost at the end here. So for PA and MD, so for PA, you definitely have to do these clinical contact care hours, right? We've said that if you are interested in that, you need to get extensive clinical contact care hours. It's about 1,000 hours at least to be competitive. So here on the top, those first 5, it looks like, there's EMT, which is, you know, an emergency medical tech who drives the ambulance and helps stabilize persons who are having emergencies, and sometimes also in transport of persons from different medical facilities. There's CNAs, certified nursing assistants, which we have a lot of students actually who do both of these things. They often work at nursing homes or hospitals just to help the nursing staff do what they need to do more efficiently. And they often can spend more time actually with the patients as well in nursing homes and in hospitals. There's phlebotomists, of course, which learn how to specialize in drawing blood. They sometimes work in hospitals, but also in lab settings. And something you may not have heard about is medical scribe. We've had a large number of students who have done this as well. They are trained to, they're often good typists. And so they often follow around the doctor or the PA and kind of transcribe what is being, you know, prescribed for the various different patients into more of a, you know, systemized system. Anyway, so it's a great thing. They learn a lot about pharmacology and standards of care, you know, by following these people around and, you know, directly writing it up. So it's a great path to go. And then there's also medical assistant jobs. You can sometimes just Google, you know, medical assistant positions. You know, oftentimes if you have a bachelor's degree or getting a bachelor's degree, you do not need to have certification, right? As a medical assistant, they will take you. The doctors or PAs will often, or the clinic will train you into doing what you need to learn how to do because they know that you're, you know, pretty educated already. But that doesn't mean that they, you know, so apply to a bunch of them if you want. Make sure your resume shows that you're either a college student or college graduate, and that often works out pretty well for our students. What you want to be careful of, especially if you're going to PA school, is that you want back of the house experience. And what quote unquote back of the house means is that you are working with the patients directly. You're taking blood pressures, vitals. They'll train you sometimes how to do certain tests. I recently had to go to an ophthalmologist, and the medical assistant was actually doing many of the tests for the doctors. So they didn't have to do so. They'd been trained on how to do such. And she was actually a student who was trying to go to medical school down the road. Yeah, so it's a great something to think about. So again, for these ones in blue that I've outlined, you know, you typically, there are courses that exist to train you to become like a medical scribe or a medical assistant or even a dental assistant, but sometimes the jobs themselves will train you, especially if you have a bachelor's degree already. All right, so something to think about. Again, for dental school, there's dental assistants, and it varies from state to state. All right, some states require that you have the certificate of training, and other states don't. We have actually had students who, after graduation, who wanted to go to dental school, actually moved to a state that allowed the dentist to train you as a dental assistant. So they got on-the-job training. So they not only, you know, didn't have to pay for a program, but they also then had a job. I think, you know, the student I can think of in particular went to Colorado literally for this reason. So yeah, and I think she liked hiking too. Anyway, so that's something to think about. And then there's also for vet school, just know that anything you're doing with an animal, right? So we want to get as much varied experience as possible. Vet techs are often going to be trained, excuse me, by the veterinarian. Excuse me, I was talking really fast. My throat got dry. So anything that works with an animal, that's what you want to have as much varied experience as possible in a lot of hours. All right, so the more time that you can get doing all these things, the better. Now, again, for med school, it is not required. Pretty much for everything else, it is required. But it is just a feather in your cap if you are applying to medical school. Now, at the bottom, I put down here for, you know, that 2-year gap year. That's very common for med students to take, especially. I will encourage you after you graduate to apply for research assistant jobs if you're going to the MD or DO path. And in that role, you will literally do research, and you will be trained by the researchers at various different institutions on how to do to expand upon your skills that hopefully you've gained in undergrad. And often it leads to poster presentations, meetings, and research article publications. We've actually had one of our students who's now in PA school, actually, she was a research assistant and got lots of publications. We have a bunch of students who are doing it towards medical school, and they've gotten some really impressive publications out of it. And that's just going to really be a huge boon for them when they apply to medical school. Now, I'm just going to put this out here. You do not sign up for these research jobs unless you can commit to a 2-year, it's usually a 2-year requirement that they want you to give them. And it makes sense. There's a lot of people applying for these research assistant positions, and they want to make sure that they have time to train you, but also to get something out of that relationship, right? So that you actually do get some work done. 1 year is just too short a time, all right, for them to actually train you and get some product out of you. And again, these are great recommendations to get, right? These are just huge recommendations to get from a researcher. And if you get a publication, that's a huge deal, right? So I will encourage those of you who especially want to go the MD-DO path to look into these positions after you graduate. And again, if you need help with your resumes, making them more research centric, feel free to talk to your science faculty about kind of how to make that shine. All right. So I think that's actually it. Let me think. The one thing that I didn't talk about was, again, recommendations. So for all of these paths that you're going on, you're going to need to get recommendations from faculty. If you're doing any of these, you're going to need at least one science faculty or her health science faculty to write a recommendation for you, attesting to the fact that you were, a decent student, a good student in the sciences. And then also I'll encourage you, and then usually there's another faculty member, it doesn't have to be science, but it often is, that you're going to need a recommendation from. So start developing relationships with all of your faculty so that, it's nice to get to know us, I think, and we're trying to be, very open to students, but also so that, someday you are going to have to, they're going to need to know you so that they can write a good, authentic letter about you, right? Don't burn bridges, all right? Students who repeatedly show up late or kind of sassy, it doesn't happen often, but we have them. Students who cheat on exams or on papers or on projects, we remember that, and we are not going to be keen to write your a recommendation if that is the case. You're also going to need to get recommendations from people you've worked with or volunteered with. All right, so again, keep those relationships developed. So even after you graduate, maybe keep in touch with people so that you can continue. As your relationship continues, they can continue to get to know you and what you're up to, so that, again, even if you apply a couple of years down the road, they can write a good, authentic letter and know who you are. You guys have a real advantage here at Johnson & Wales that our classes are small, right? So, we cap them usually around 30, right? And we typically know who you are, and we remember what you were like as a